Every community has unique challenges, and it's no different when it comes to health care. Dr. Richard Gilroy with Intermountain Medical Center is here to talk about screening Utah communities for problems that they might not know that they have. So we are also focusing on liver disease. Let's talk about what you mean by different communities.
So different communities within Utah, or somewhere in the realms of about 14% of the population is going to be Hispanic, maybe as high as 19%. In that population, they have a high incidence of fatty liver disease, which we can screen for the consequence of with a thing called a fibroscan, which we have done now in one community health fair, and we're now going to go to others so that people know if they have a problem.
And what would be the repercussions of having a fatty liver?
So fatty liver, for some people, it's just a fatty liver. But for others, it can lead to cirrhosis. And the most common cause for cirrhosis we see is fatty liver disease. So that population with a higher incidence of the problem that may potentially lead to cirrhosis is the group we look for. But then there's other communities. The Islander community that we have in the valley, about 19,000 people. Within that population, there's a high incidence of hepatitis B, in particular if you're born in places like the Marshall Islands or Tonga. And in those people, we can make a significant difference by identifying a disease we can treat, control and cure and prevent from becoming a problem, which we see in the form of liver cancer.
And what would be some of the symptoms for each of these types of liver disease?
That's the problem. There aren't any symptoms generally.
Aren't any.
You only find you have the problem when you have symptoms, when it's usually too late.
That is powerful what you say, and so that's why it's important that you are actually going into these communities that are at high risk.
Intermountain now has an endeavor to have people live the healthiest life possible. To do that, we need to go out to them when they are healthy and identify of any potential problem in the future and address it.
And we're not only talking about ethnic groups, but socioeconomic issues, different levels.
Correct, and that's the other important part about that is there are many people who are in need who don't have the ability to get health care. So when we go out to the community and we identify these people, then we also apply to that population an ability to be able to find ways to treat them. We have clinical trials in fatty liver disease, for instance, of drugs that will be licensed at some stage in the near future, and these people can access those clinical trials, access the screening processes associated with clinical trials, and provide them health benefits.
Well, do you ever see a time where you do go to the doctor's office and you automatically check your liver this way?
Well, see, most people don't, and most people see liver tests, and doctors see liver tests with minor elevations, and the action is, let's check them again later. What we do with fibroscanning, we can go out and physically place it on your side. We can tell you if the fat is a fat process that's going to lead to a problem, and we can identify scarring. And if you have scarring, you've got a big problem coming your way if you don't do something.
Dr. Gilroy, thank you so much. Always saving lives and talking about your liver and the health of it and healthy people. Thank you so much.
Thank you very much for having me.
We'll have a link on our website at goodforutah.com.